delayed batch of Johnson & Johnson vaccines is on its way to South Africa this morning. The 60,000 doses, you'll remember, was expected to hit our shores earlier this week. Heidi Giokos is with us here at eNCA following the developments, also following the aircraft. Hello to you, Heidi. So we're starting to rack and stack the number of vaccines in South Africa, but we're, just over 2 hours away from wheels down.
Yes, most certainly, Gareth, and details were quite sketchy with regards to which aircraft was going to be bringing in the vaccines. Last time we saw SAA flying all the way to Brussels and touching down after months of not flying, but that's not the case this time around, and we have not been able to get further clarity from the Department of Health and other government officials with regards to when exactly vaccines are coming in, but we managed to squeeze out some information. We do know that over 60,000 Johnson & Johnson vaccines will be touching down in South Africa in the next 2 hours or so. We do know that that flight is coming all the way from Zurich, landing in Johannesburg in about 2 hours, 6 minutes. Of course, media have not been given an opportunity to witness this next arrival, but there's been much criticism with regards to how much and how quick we are getting the vaccines. Government has, of course, indicated that the reason why there's been such a delay and the deadline to inoculate over 1 million healthcare workers by the end of March has now been pushed back to mid-April is due to the fact that there's a global shortage of the vaccine. Of course, many countries are trying to get their hands on this vaccine, and of course countries with bigger purses and more resources are able to get the vaccine much quicker. And because the AstraZeneca vaccine here in South Africa was put on hold, it literally threw a span in the works for government, and this is why they had to gather the eNCA trial and put the eNCA trial together, and this is why we're able to bring Johnson & Johnson vaccines on a trial basis, which also creates its own limitations, because if a vaccine is brought in on a trial and academic purpose, this does not allow for government to bring in over 1 million vaccines at once, which of course limits how many healthcare workers we can inoculate at a given time.
Just elaborate for me, if you could, Heidi, why there has been such an issue with the aircraft that have been bringing the vaccines over. There's going to be criticism again now, isn't there, that it's a Swiss air flight that I understand that we're busy tracking this morning, LX288, Lima X-ray 288. Why has there been so much kickback about the type of aircraft and the carrier that's bringing it over?
Well, the first time we saw vaccines landing in South Africa, the AstraZeneca vaccine, that was on an Emirates flight. And many raised questions as to why the national carrier, South African Airways, was not flying out to fetch the vaccine. Then the second time we saw the Johnson & Johnson vaccine coming into the country, that was a chartered flight. And when we saw the second batch of the Johnson & Johnson vaccine coming in, that was on an SAA flight. But many were raising questions as to how SAA was flying all the way to Brussels to fetch the vaccine. If that is not a route that SAA ordinarily takes, the airline is still in business rescue. Many were raising questions as to the size of the aircraft and how big the aircraft was, flying all the way to Brussels, and what cost came with that. We do understand that from the Department of Public Enterprises, they estimated that that trip alone cost about 5 million rand. Many were questioning, whether or not the government has that money to be flying all the way to Brussels, and why we could not acquire a charter flight or other services already coming into the country to bring in the vaccine. It's quite strange that SAA is not flying out again. We're not exactly sure of the details. And again, Gareth, I think it's important to highlight that details have not been forthcoming. We have tried time and time again to get further clarity on the whole procuring of the vaccine, when the vaccine is coming in, who's bringing in the vaccine, and those details have been quite sketchy, and we managed to figure out that Swiss Air would be bringing in the vaccine today. And we know that previously, I think in the last week or so, Swiss Air had also brought in a Johnson & Johnson consignment. So there's been much criticism as to the state of the national carrier, the state of government's debt, and how we are able to afford such an expensive trip to fetch the vaccine. Yet government is defending it, saying it's saving lives, it's bringing in a very important consignment.
And I don't think many people would argue the importance of it, but still government communications needs to communicate with us and with South Africa so we can know what's going on. Heidi Giokos, I'm sure we'll touch base again a little bit later. The flight LX288 currently over Angolan airspace, making its way towards Joburg, as Heidi says, just after 9 o'clock this morning. 9:06, I think, if my maths is right. It should be wheels down. Heidi Giokos back with